All right, welcome back, guys. Today we're going to cover Chapter 8, Lifespan Development. So we'll be talking about kind of some of the differences in anatomy and physiology, a few more things about infancy, toddler, preschool age, school age, adolescence, early adulthood, middle adulthood, and late adulthood. So infancy, that is from birth to 1 year old. So talk about physiologic stuff. Normally, between about 6.6, 7.7 pounds at birth, so 3 to 3.5 kilograms. Their weight doubles by 6 months and triples by 12 months. Their head is about 25% of their total body weight. So their airway, very narrow, short, very easily obstructed. It's very important to note. Their nose and their diaphragm are used very heavily for breathing. So antibodies are passed from the mother to child during pregnancy. They're also passed through breastfeeding. But overall, their immune systems aren't quite as capable as an adult. One thing this chapter doesn't talk about is, we have to consider whether or not this infant, especially in that first month of their life, if they had issues with during their pregnancy or delivery, were they born term age or were they premature? Do they have a NICU stay? And whether or not they have any medical history. We're pretty fortunate. A lot of the patients that we see at this age do not have a lot of medical history, but there are plenty of birth defects and very, very early childhood complications. So it's very important to still ask those questions. So during infancy, the Moro reflex or the startle reflex, it's where the patient would throw their arms out, spread their fingers, and kind of grab with their fingers and arms. It's a very normal reflex. That reflex should be intact. The palmar reflex grasps an object that's placed in their palm. So if you put your finger in their hand, they should grab onto it. The rooting reflex or the hunger reflex, it's where they turn their head to the side when their cheek is touched. And then sucking reflex is when they suck their lips when their lips are stroked. Sleep patterns. So normally sleeps between 8 to 16 hours throughout the day and night. Soon changes to 4 to 6 hours during the day and maybe 9 to 10 hours at night. And by 2 to 4 months, most will sleep through the night. That being said, when it comes to the younger kids, infancy, preschool age, toddler, they're not great historians. They can't tell you anything, right? There's normally somebody on scene, a caregiver of some kind on scene that knows everything about the patient. So when it comes to is this patient sleeping normally? Just because they say, oh yeah, they get 5 hours during the day and 9 or 10 at night, that might not be normal for that infant. So always ask the patient, the patient's parents or caregivers, what's normal for that patient. Their extremities grow in length from a combination of growth plates at both ends of the long bones. So their fontanelles are not fused at birth. The fontanelles are the little suture lines in the skull. So the posterior fontanelle closes normally in 2 to 3 months, and the anterior fontanelle within 9 to 18 months. They can be used as an assessment tool prior to that fontanelle being fused. So if they're sunken, that can indicate dehydration. And then bulging fontanelles without crying indicate increased pressure inside the skull. So something like meningitis, something like that. Other causes of infection that may affect the brain. So psychosocial bonding, the sense that needs will be met that occurs during this infancy. Trust versus mistrust, so a desire for an orderly, predictable environment. Scaffolding, so learning by building on what's already known, and then their reaction to the environment. And again, when it comes to younger kids, there's the textbook, and then there's the real life. Some kids are much more trusting than other kids. So I know when I went to EMT school, it was taught, oh, if you show up and a kid immediately trusts you, that kid, there's something wrong with that kid. That's not necessarily true. Go back to the parents and ask them, is this normal? Whoever their caregiver is who seems to know more about the patient, they will know what's normal and not normal for that infant. Toddler phase, that's between 12 and 36 months. So talk about physiologic stuff. Body temperature can range between 98.6 and 99.6. Their weight gain will be around 4.4 pounds or 2 kilograms per year. Their body systems improve in efficiency. So their immune system starts to develop a little stronger. Everything starts to improve. In their pulmonary system, the terminal airways branch and grow. Their alveoli increase in number. In their nervous system, the brain is about 90% of the adult brain weight. Remember, because of that, their heads are larger in proportion versus an adult. They start to develop fine motor skills. In their musculoskeletal system, their muscle mass and bone density increase. Their immune system. So immunity develops through exposure and vaccination. Because of their age, their exposure to illness, they are more susceptible to illness, but their immune system is working on growth. Their teeth, all primary teeth should be coming in by 36 months. Toilet training is possible at a pretty early age of 12 to 15 months, but not always psychologically possible until 18 to 30 months. They begin to understand that words have meaning. They begin to understand cause and effect. They may develop separation anxiety. They can begin to develop magic thinking. They have an imagination. They can engage in play acting. They start to master language basics that they refine through later childhood. All right, preschool age, between 3 and 5 years old. So in this preschool age, physiologically, their body systems continue to develop. Psychosocial, so they begin to develop interactive and social skills. Their peer groups provide information about other families and the outside world, and peer interaction offers an opportunity for learning, making comparisons, and being part of a group. It's a really fun age. They really start to learn a lot. Okay, school age, so ages 6 to 12 years old. So physiologically, their body temperatures can range between 98.6 and 101.3 degrees Fahrenheit. Their weight gain will be about 6.5 pounds, 6.6 pounds per year, or 3 kilograms. The growth around 2.5 inches per year. Primary teeth will be shed and replaced with permanent teeth. Psychosocial. So the parents spend a little less time with the child, provide general supervision. They don't have to be quite as, the overwatch doesn't have to be quite as in-depth. Their decision-making skills develop, their self-esteem develops. It's affected by popularity, rejection, emotional support, and neglect. Moral development begins based on rewards and punishments for behaviors. And moral reasoning appears and control of their behavior to internal sources. Adolescents, ages 13 to 18 years old. Um, Physiologically, there's a rapid 2 to 3 year growth spurt that begins with the growth of feet and hands, and then arms and legs. Sexual maturity is reached, and secondary sexual development occurs. Psychosocially, they strive for independence and individual identity. The interest in sex develops. Body image becomes more of a concern. They may be prone to self-destructive behaviors, and a personal code of ethics develops. Early adulthood, that's ages 19 through 40 years of age. So physiologically, lifelong habits are formed. Peak physical condition occurs normally between 19 and 26 years of age. Psychosocially, job and family stress levels are typically high. Marriage, childbirth, child rearing often occur. Accidents are the leading cause of death. Middle adulthood, ages 41 through 60 years of age. So physiologically, there's no significant changes in vital signs. Vision correction may be needed. Cancer, high cholesterol, and heart disease often develop. Weight control becomes more difficult, and menopause may begin for women. Psychosocially, task orientation increases. Problems are viewed as challenges rather than threats. Empty nest syndrome may occur. In this age, middle adulthood, children are leaving the house. They can be concerned about their adult children and elderly parents. In this age group, normally their parents are still alive. They have children that are leaving the house. There's a lot of concerns to be had. Late adulthood, 61 years old and on. So physiologically, vital signs depend on the health and physical condition. Their cardiovascular system is less efficient. Their blood volume decreases. Their respiratory system deteriorates and increases the likelihood of respiratory disorders. Endocrine changes can decrease metabolism. Sleep-wake cycle may be disrupted, and other body systems kind of deteriorate as time goes on. Psychosocially, they're faced with a lot of challenges: living environment, self-worth, financial burdens, death and dying. They're all large concerns to anyone of any age, but as a person gets older, these are big challenges to face. Motivation, personal interests, and activity level can enhance in late adulthood. Everybody kind of approaches this stage of their life differently. All right, chapter review. So understanding basic physiologic and psychosocial development for each age group will assist in you communicating with and assessing patients of various ages. We didn't talk about that a whole lot in a lot of depth, but like I said, depending on your younger patient's parents or caregivers for a more dependable history, that's extremely important. When it comes to more of the school age children, how you speak with them, get on their level, be respectful, be kind. But understanding that will help you communicate and assess them. As far as assessment goes, we talked about the younger patients and their physiologic changes that occur or that are present, as far as their larger head in proportion to their body, their alignment for airway if the patient's lying supine. In older adults, there's a lot of medical history to take into consideration. So having a medication list or a list of their medical history can kind of help you determine potentially the underlying cause of what's going on. Physiologic differences between the ages will also affect your care. So examples include differences in the respiratory systems of younger patients and the effect of pre-existing medical conditions of older patients. Infants and young children have less developed and smaller respiratory structures, which can make respiratory conditions worse. Your ability to communicate with younger patients will depend on their stage of development. So it can range from fear of strangers to separation anxiety or embarrassment, depending on their age group. Older patients may have issues with denial or depression over medical conditions. So having that understanding of the patients in different age groups is very important. Things to remember. So infants undergo big bursts of anatomical and psychosocial development in the first year of life. Although preschoolers begin to develop independence and reason, in many ways their psychosocial development is similar to that of toddlers. And again, this book puts everything in very black and white, but in real life, it's not always that easy. Very important to know that patient, what's normal for that patient that you're with, not just what the textbook says that they should be acting like. School-age children are often independent and logical, but they may regress to an earlier stage with illness or injury. Adolescents are reaching physiologic maturity, but they often face difficult psychosocial challenges. So just because they seem, mature physically, maybe emotionally, psychosocially, they're not at the same maturity level that they appear physiologically. Early, middle, and late adults vary greatly in terms of physiological development and conditioning, and they also face psychosocial challenges unique to adulthood. So, the age groups of the younger children are, infants are newborn to 1, and then we have toddlers that are between 1 and 3 years of age, and those are pretty small age groups. We get to adulthood, we go from 19 to 40, and then 41 to 60, and then 61 plus. Those are large. It's a large time frame. So something to remember and take into consideration. That's it for this chapter. It's a pretty short one. We'll talk more about actual assessments and things in class. We'll look forward to seeing you here in a couple days. Thank you very much. We'll see you on the next one.